Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Ohio University Lancaster.
Hello and welcome back to our Fairfield Today show. We are coming to you again from Fairfield Medical Center, and we are actually on our second floor labor and delivery unit today. Going to kind of go back a little bit in our history. You probably have heard the buzz that Fairfield Medical Center is coming up on its 100th anniversary. And if there's 100 years, we know we have a lot of stories out there, and we've recently put a call out on our Facebook page. We're wanting some photos, we're wanting your stories. We know that records were kept a little differently years and years ago, so some of those we don't really know about. And obviously many of us were not here at that time, so we're asking you, as you're watching the show today, to be thinking of some things that you might know, maybe some family members or something over the years that have been here at the hospital and have some really interesting stories and some photos. Think of receipts or hospital bills, anything like that that might be interesting to us. We have a lot of successes and a lot of accomplishments over the years, one of which is a guest of mine today. I doubt that introductions are probably necessary, but in case there's someone out there listening who does not know, this is Dr. Paul Edaddy. He's with us today. And so we're going to talk to you a little bit. We thought it might be a good connection since we're talking about the photos, and we had asked for infant photos. We know in 100 years a lot of babies have been born here, and he's responsible for quite a few of them. So kind of take us back a little bit, and let's get our audience kind of brought back to where you first came with us. We know you came in 1981.
That's right.
So talk to us a little bit about your history, your education, your training.
Okay. I trained at Mount Carmel Medical Center in Columbus and did a residency there in obstetrics and gynecology, and then I was actually recruited here in 81 by Dr. Leifer and some of the other physicians in town as an OBGYN. I actually grew up in Chillicothe, but this town is very similar to Chillicothe, so it was an easy solution, and I was welcomed immediately and started delivering lots of babies even the very first year when I came here, and I also did gynecologic surgery, and I also did some cancer surgery, some low-stage cancer surgery here in Lancaster for many years.
So on that, the technology that you brought to us, tell us a little bit how that changed healthcare here at FMC. So we know that you brought laparoscopy, correct?
Yes.
Okay.
Laparoscopy or Band-Aid surgery is a procedure that, probably in the mid-70s, maybe early 80s was just coming to fruition, and what it really did was it enabled us to do things in the abdomen without making a large incision, and we could send people home the same day after we did the surgery. We'd go in through the belly button and fill the belly up with some gas, and we could hook a camera up. I also was trained in laser surgery and during my training in Columbus, so the hospital purchased a laser for me, a CO2 laser, so I used that routinely. Whenever I'd go in the belly, I'd have that available in case we needed to clear up adhesions or have problems with endometriosis or need to cut a nerve that was causing pain or things like that. So that's what we use that for. So. And the general surgeons use it, of course, for the gallbladder and taking out the gallbladder, which used to be a big major surgery. And after the laparoscope, it was an outpatient surgery and continues to this day to be an outpatient surgery. So that's one of the things that I did.
You mentioned the laparoscope sort of as the Band-Aid thing, but I know we were a lot more intense. There was other surgeries you mentioned. That you may have done some surgeries on some cancer. Right,
yeah.
Did you bring that here too? Is that when we kind of first started doing that here at the hospital?
Right. We, at this point, back in the 80s, most of those procedures were being done at Ohio State, and we did them at Mount Carmel. My whole last year of training was done basically with an oncologist Dr. John Bootsellis, and he trained me in gynecologic cancer surgery. So I was able to offer that service, and we did what are called radical hysterectomies, which is a much more complex operation where we actually take the uterus tubes and ovaries out for big tumors, and then we also take out the lymph nodes that surround the aorta and the big vessels in the abdomen, and that would be the site of spread if it was an advanced tumor. And then we could offer the patient a lot more survival if we were able to take those out. And we did that. Dr. Pondy and I did those for 30 years here. So.
And that was in the 80s? We brought that here in about the 80s?
Yeah, that was in the 80s when I came in 81. And I remember actually doing my first one here. And it was referred from one of the other doctors who had not been trained in that, so one of the other gynecologists. So it was pretty fun, and of course I was anxious to do it, so everybody was happy, and the patients, I was very fortunate. A lot of the patients that I operated on did quite well during that time.
So as I mentioned earlier, we had put a call out there for some photos of some babies, because we know we've had a lot of them delivered here, and he played a big role in that as well. I think everyone wanted to get into the practice of Dr. Stevenson and Leifer, and I forget who all was involved at that time. So how many babies altogether do you think?
Well, counting all the babies that I've delivered, I did a residency in primary care at Grand Hospital. Then I did 4 more years at Mount Carmel. I did initially I did the primary care at Grant, then I did 4 years at Mount Carmel. And then I did lots of babies here, and I think the first year I was here I did 350 some. So we quit counting in my office as far as birth certificates at 7,000. So we delivered a ton of babies, and of course some of those were at Mount Carmel too. So, and a Catholic hospital, that's where they have lots of babies. So,
that's incredible.
Yeah.
So of the 7,000, we have a pretty interesting story here at Fairfield Medical Center that's also back from the 1980s. We have 2 other guests that we're going to introduce to you. If you'll give us just a minute, we'll be right back. Welcome back to the Fairfield Today Show. Again, we are coming from Fairfield Medical Center, and we're talking about our centennial celebration that will be kicking off this year. So we have 2 other special guests that I was telling you we have today, and I'm pleased to introduce to you Mr. John and Diane Engel. You will go ahead and come in.
Hi, John. How you doing, buddy? Good. Great to see you.
So please have a seat. Thank you for joining us today. So we're going to share a little bit about your story and the significant role that you played in the life of Fairfield Medical Center here, because I understand there was a pregnancy there that was pretty significant. I believe you were our second in vitro, is that right? Pregnancy that was delivered?
That is correct, yes.
That's correct, okay.
Yep.
So take us back a little bit, if you wouldn't mind, and talk to us. I've always kind of wondered how you get your arms around just the whole process of even thinking about going there, having that done. I mean, that's got to be pretty huge. So take us a little bit about, how that all come about and what that's like.
We had been married when Kristen was born, 14 or 15 years.
Okay.
And we had been living in Oklahoma. We had just learned of a transfer back here with my employer, and we had been going to the in vitro clinic at the University of Oklahoma. And Diane was their first pregnancy at the University of Oklahoma. And
So this delivery was not your first attempt at that, is that correct?
we had made 2 previous attempts, yes.
Okay.
So this was our 3rd try, but we have 2 older daughters
Okay.
that are adopted, which we would have adopted a 3rd, but it's very hard to adopt a baby. So this was kind of our chance to have another one. So
We found out Diane was pregnant the day the movers were were there to pack us to move to Ohio. So there was a scramble to find someone to care for Diane, and we were incredibly fortunate to be with Fairfield Medical and with Dr. Deddy. And it just worked out wonderfully for us.
So you had relocated here
We
and
were.
then found. Okay. So how did you meet? How did you come about? How did you hear?
My doctor in Oklahoma called you. She had to check him out to see whether, because she originally thought she had a colleague that she had gone to school with, and she originally was going to send me to Columbus. When she found out how far away it was, she goes, plus they were saying all these things, and they made me cry, and they're saying, well, you have to go through this again, you have to go through that again, and I said, so I called her immediately. I'm like, she goes, where do you want to go? And I have to say, it's because my sister had Dr. Deddy, and I said, the only doctor I know is Dr. Deddy, and my sister thinks he's great. So then you got the 3rd degree, I'm sure.
Oh, yes.
Because it's not, I took shots for 5 months with the pregnancy. So it was kind of, he gave shots.
Oh, really? Okay. So you did this at home?
Mm-hmm.
Okay.
Yep.
Daily,
Daily for how long?
5 months.
5 months. Okay.
just to make sure we would sustain the pregnancy.
So, and that was here in Lancaster, or that was in?
We were here within a week after she found out she was pregnant. And so the whole pregnancy really was here,
Okay.
and was quite a journey.
So tell us, Dr. Deddy, is that pregnancy, something like that, is that a high-risk pregnancy? How is that different from if I was, a normal pregnancy versus?
Yeah. Any pregnancy that involves assisted reproductive technology, or ART, A-R-T, which is in vitro, we call it test tube, but technically in vitro, is a high-risk pregnancy, because what we have to do is we have to figure out some way to get everything to hit just at the right time. And then once we have a pregnancy, then the concern is keeping it in there. And since we're putting it in there, it may not have the opportunity to adhere to the wall of the uterus, and that's the injections then that John gave Diane were to help that implantation, and which would occur, in a pregnancy that was just spontaneous. That medicine would be coming from her ovary. In this case, we wanted to make sure. So the implantation problem is the big problem, one of the big problems with the in vitro. So we gave her additional progesterone, which helped the baby, the egg adhere and grow.
Okay.
So
I see you sitting over here shaking your head no when I ask if this is a high-risk pregnancy. Why?
I was more normal than anybody you had.
As far as
we
what
didn't
she
have-
required, but as far as, I guess it was just high risk as far as just the vigilance.
Yeah.
And because it's such a tremendous investment that you guys went through, as far as just all the injections and all the cycles and all this. And, me, I take care of all my patients the same way, care about them the same way, but the in vitros were just beginning. We were just beginning to get those, and the other pregnancy was the first one in Central Ohio, and then you were the second.
And I think if it's who I'm thinking it is, I think I kept that little boy.
Really?
Mm-hmm.
And
Yeah.
babysat
I think
for
I
him.
babysat for him.
Yeah, so he's all grown up too, like Kristen. Yeah, that's for sure.
So you're here then, and you have met Dr. Deddy, and you've done your initial checkups and everything. Tell us, what is that like through the process of your 9 months here that you were? Is this weekly visits? Is this? You said you're pretty much one of his most normal.
I don't think I came any more often than anyone else. I might have had more at that time, more ultrasounds than anyone else, maybe. But I had a cousin that was going through a pregnancy at the same time, and I really don't think it was much different.
Okay.
She was really an easy patient to care for too, and you can tell how motivated to this day they both are, and what a great team they were the best. So as far as they minimized and mitigated most of the risks. She really took care of herself, and John made sure of that. And so that really helped a lot in getting the little one here, so we were very blessed.
Yes.
Very blessed.
So it's delivery day. Can you think back and kind of tell us what it was like here? Can you talk about the nursery and what you saw as you came in and your thoughts? And
We
was this?
went into a birthing room, which was a new concept at the time.
Oh, okay.
And, well, we had been into Dr. Duddy's office in the morning for a routine visit
The day after I was supposed to
the
be
day
there.
after the due date.
And
you know,
he
we
still gets
obviously-
her birthday mixed up.
Well, he's a day late. But the bottom line is that we were there, and Dr. Deddy said, Diane, you're here, John, you're here, I'm here, let's go have a baby. And we did.
Really?
Well,
And
he
Pretty much the way it
traveled.
went.
Yeah, because he traveled for work. And so that, he wasn't always, it wasn't like an everyday basis. So I said, what'd you say? You told me I had to be there. What you said, I'll see you in an hour. I'm like, I can't do that.
Yeah.
I mean, at this point in time, I had nothing ready for a baby. I don't know what I thought was going to happen, but,
How-
I don't know. Because with the other two, we kind of found out one day, went to the store, picked up stuff, and picked the babies up the next day. So I guess we thought that's the way it was going to happen.
Sure, sure.
So,
Well,
but,
you're
and I said, I've got two
conditioned-
at home, and I've got, you know how you have laundry here, and I can't, I think he gave me 3 hours.
Nice of him.
That's pretty generous.
Yeah, he gave her 3 hours, and we came, and as I mentioned, we were in a birthing room that was a new concept at the time, and
So what was that like when you say birthing room? What?
it was just a private room where you were actually delivering babies right in the room at that
Okay.
point in time.
Yes, that's right.
And it did not go as planned, so we ended up with a C-section about 9 o'clock in the evening.
Yeah.
And
So you're asking me what I saw? I saw nothing.
it was just an amazing event in our lives, certainly, and we felt like we had everything going for us, and everything was right here for us, and it went well.
We had just initiated the birthing room concept, and I'd helped Dory Whaley, who was director of nursing here, and I helped Dory lay out a floor plan, and the whole idea was to have rooms instead of. Initially, what we had was they'd be in the labor room, and then we'd move them over to a delivery room, and then they would deliver there. In the birthing room, we can actually take the beds apart. This is what we do today, still to this day, and deliver right in there. So it was a new thing. And then, of course, afterwards, we did the rooming in, the mom with the baby, so it was skin to skin originally, and then the babies, could stay, except when mom needed some rest. So that was sort of a new concept. And this was during the Lamaze days when we were, everybody was doing Lamaze and their breathing exercises and
I don't think that's much of a thing anymore. I don't-
train childbirth.
They
No,
don't do that anymore?
everything now is epidurals. Everybody gets an epidural. And
Oh,
the
I'd
pain-
much do
and the pain's,
that now.
and the pain's gone. Yeah,
Nah.
but she did great.
So baby was here. And I
Yes.
think if you're at home, you're probably seeing a picture of her right now on our screen. So tell us what that moment was like for all of you, because this is, again, second in vitro baby that we've had done here. So you had to have been somewhat nervous, I would think. Really? As a mom, I would just
This
think
was
since
my
this
third
was
baby.
Not,
I
but this was
mean,
not
and
your typical,
essentially. I mean-
pregnancy. It's a little
Yeah,
different.
first pregnancy and third child, so the other two girls had to come see the baby, of course. Kristen is 22 months younger than Elizabeth.
Okay.
As a matter of fact, we had started the in vitro process before we adopted Elizabeth and took a break during that time to basically have Elizabeth and get Elizabeth as part of our family. I will tell you that we think that our kids were meant to be a part of our family, and they do too. And they all believe they have their special story about how we became a family. And certainly Kristen, at first, was not accepting of the fact that she wasn't adopted. That was her sister's special stories. So she has her own special story.
Oh, that's right. That's cool. That's very cool.
Well, we have one more person that we're going to talk with today that's going to kind of bring everything on home for us and kind of summarize where we are today versus where we have been in the past with our deliveries. So hang with us and we'll be right back. Thanks for coming back with us again. We've just been sitting here reminiscing over some of the things over the years of 100-year centennial here at the hospital. And with us is Diane and John Engel, and we also have Eva Herring-Payne with us, and of course Dr. Deddy. So finish up a little bit about the story you had started to tell with us, how the media was involved the day, because this was pretty significant, and I remember that.
At that point in time, worldwide, there were less than 1,000 in vitro babies. So Kristen was in the first 1,000 in the world. And when she was born, the Eagle Gazette ran a story. The Daily Oklahoman in Oklahoma ran it as a front page Sunday story because of the conception being at the University of Oklahoma.
Sure.
And the local TV stations came down. And of course, in that day, it wasn't that they ran live feeds, of course. This is almost 30 years ago, so everything was videotaped and then rushed back to Columbus and put on the air. And so they came down and they had Dr. Deddy in the lounge by the elevators on the maternity floor doing live interviews or interviews for videotape, I should say. And so it was kind of a media circus for the hospital because of all the people in and out and about. And there were even some things going on behind the scenes here.
Yeah, the nurse,
Nadine
Hampson. She was tickling Kristen's feet and saying, "You have to wake up, baby, so they can see you. See your eyes." She was,
TV.
but
Wow. So Eva, you're with us too, and you kind of remember over the years Dr. Deddy and his service here at the hospital. And
Oh, yes. Yeah, we always loved Dr. Deddy, working with Dr. Deddy and taking care of his patients. Yeah.
We were kind of talking about how everybody knew when Dr. Deddy was in our facility. You didn't have to really see him.
Yeah, you could smell him sometimes. So that was always a nice thing. We could always smell him before we seen him. So, yeah.
So I invited.
Yeah, he couldn't hide from us.
So I invited you to kind of help us close out our interview here today. So you've kind of been listening and you've
Yes.
heard some things that have happened, 20, 30 years ago. So talk to us about your clinical nurse leader here, educational leader, is that correct?
I'm a maternity clinical educator, yeah, as long with being a staff nurse also. I still do hours on the floor too, so.
Okay. So tell us, you've been listening, again, as I said, and you hear how things were different, and I just know how they were when my kids were born in the 80s. Bring us up to speed today, some of the changes. They talked about the birthing room.
It's
And
exactly like what Dr. Deddy was saying. When I did my education for nursing, it is what they used to labor in the rooms and they would take them over to delivery room. But then the whole concept of the LDR, labor delivery recovery rooms happened. So it is that way today still. We still do the labor and delivery recovery in the room so the family can be part of that and make sure it's a good memory and make a safe visit for them here.
okay.
So.
We had a lot of activity here lately. I know, just because I was here a day, there was like 13 of them born in a
We've
day.
been very busy. I'm not sure what happened, but yeah, we had an
Full
explosion
moon.
here.
We think it's full moon.
Yeah, and we've been busy today too, so I had to make some change our plans today because of that. But yeah, lots of good babies being born.
In doing history review lately for the Centennial, I didn't realize it, but even we were talking about how the hospital has always kind of been on the cutting edge, trying to be state of the art, bringing the new technology like he brought here. I didn't realize it, but even back in 1916, we had done our first cesarean section here at the hospital. So even then, the community hospital was always trying to have as much of the latest technology and care available to our community. So I want to thank our guests today, and again, hopefully this brought some memories back to you. We still have the call out for your stories, your photos. As we said, we know they're there because we have perfect evidence here today. So please reach out to the number that's on the bottom of the screen or the email address and give us your stories and your photos, anything over the last 100 years. And be looking forward to the coming year. Also save the date for August the 22nd on your calendar. We're not going to really give you the details of that yet, but there's something pretty big and special coming for our community from the hospital. So thank you again for joining us.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Ohio University Lancaster.